I've worked in emergency rooms for over 30 years. So listen carefully. Most people over 60 don't survive their first heart attack if they're alone. That's not fear-mongering, it's fact. Nearly half of all heart attack deaths occur before the patient ever reaches the hospital. Why? Because people hesitate. They second-guess. They panic. They don't know the simple, life-saving actions that keep blood flowing until help arrives. And the truth is brutal: if you don't know what to do, you can be gone in minutes. Every day, I see patients brought into my ER who could have lived if they'd taken just one or two key steps. Crushing chest pain, breathlessness, dizziness, cold sweat, and by the time they arrive, the golden window has closed. But here's the good news. There are science-backed, simple techniques that anyone, even alone, can use to double their odds of survival. These aren't myths or gimmicks. They're real, doctor-approved strategies I wish every senior knew. In this video, I'll share 7 life-saving tips that could mean the difference between tragedy and survival. And pay close attention to number 3. It's so powerful that research shows it can determine whether you walk out of the hospital alive. All medical references are listed in the description below. Before we begin, how old are you? Drop your age in the comments. I read and reply to everyone, just like in my clinic. Now, let's start with number 7, the first step that can decide whether you make it out alive. 7. Call emergency services immediately. The moment you feel the signs of a heart attack, call for help. Right away. Don't wait. Don't tell yourself it's just indigestion. Every minute of delay kills heart muscle. Cardiologists say it best. Time is muscle. According to the American Heart Association, patients who call within the first 5 to 10 minutes of symptoms have up to 50% higher survival odds. Yet nearly a third of people over 60 wait over 2 hours, often because they don't want to bother anyone. That hesitation can be fatal. If you ever feel crushing chest pressure, shortness of breath, nausea, or cold sweat, assume it's a heart attack. Call emergency services without hesitation. If it's nothing, you lose nothing. If it's real, you just took the most important step to save your life. While you wait for paramedics, what you do next can keep your blood moving and buy precious minutes. 6. Chew an aspirin. After calling for help, chew, not swallow, an aspirin. Aspirin is one of the most effective clot-fighting drugs available without a prescription. It helps prevent the clot from growing, keeping blood flowing to your heart. A major study in The Lancet found that taking aspirin during a heart attack reduced death risk by 23%. But timing matters. Chewing allows it to work within minutes, while swallowing takes much longer. Keep a bottle of uncoated aspirin in an easy-to-reach place. If you're not allergic and your doctor hasn't told you to avoid it, chew one full 325 milligrams tablet at the first sign of symptoms. That single pill can slow the damage until help arrives. 5. Loosen tight clothing and sit upright. When a heart attack strikes, every bit of strain on your heart matters. Tight belts, collars, or waistbands can restrict blood flow and make it harder for your body to get oxygen. So the first thing, loosen anything tight around your chest, neck, or waist. Next, sit upright with your back supported, not flat. Lying down increases pressure on your heart and lungs, forcing them to work harder when they're already struggling. Sitting upright helps your lungs expand, improves oxygen flow, and reduces that crushing feeling in your chest. Take slow, steady breaths and stay as relaxed as possible. Think of this step as giving your heart room to breathe while you wait for help. It's simple, quick, and it can make a real difference in those critical minutes before paramedics arrive. 4. Cough strongly if you feel faint. If you suddenly start to feel lightheaded or like you're about to pass out during a heart attack, don't panic. Start coughing firmly and repeatedly. This technique is called cough CPR. When you cough hard every 2 to 3 seconds, the pressure inside your chest increases. That pressure helps push blood out of your heart and up to your brain, keeping you conscious a little longer. It's not a replacement for medical help, but it can buy you precious seconds until paramedics arrive. Take a deep breath, then cough forcefully from your diaphragm, as if you're trying to clear something stuck in your throat. Repeat this cycle until help reaches you or the dizziness eases. Those strong, rhythmic coughs can act like mini heartbeats, keeping your circulation going and your brain awake just long enough to survive. 3. Unlock your door and keep your phone nearby. This step sounds simple, but it's critical. Unlock your door immediately so emergency responders can reach you without delay. Every extra second counts, and you don't want them wasting time breaking through a locked door. Next, keep your phone close, ideally in your hand or on speaker so you can talk without straining. Many seniors collapse before rescuers can get inside simply because they didn't unlock the door or couldn't reach their phone. Don't let that happen to you. If you live alone, make it a habit to keep your phone near you at all times, especially in the evenings or when you're not feeling well. Think of your phone as your lifeline and your unlocked door as the open bridge for help to reach you. These few seconds of preparation can literally save your life. 2. Take slow, deep breaths. When panic sets in, your body releases adrenaline, raising your heart rate, blood pressure, and oxygen demand. During a heart attack, that's the last thing you need. So your job is simple. Breathe slowly and deeply. Inhale gently through your nose, letting your stomach rise, not your chest. Then exhale through pursed lips, as if you're blowing through a straw. Try for 6 to 8 calm breaths per minute. This deep, steady breathing increases oxygen to your heart and brain while lowering the stress hormones that strain your heart. If fear creeps in, focus only on your breathing rhythm. Inhale, exhale, slow and steady. Each breath gives your body a moment of calm, keeps oxygen moving, and helps your heart work more efficiently while you wait for help. Remember, calm breathing means controlled survival. 1. Stay still and stay calm. This is the most important step of all. Do not move. Every movement, standing, walking, pacing, forces your struggling heart to work harder, using oxygen it simply doesn't have. Staying completely still is your best chance at survival. Focus on relaxing your muscles and keeping your breathing slow. Tell yourself, I've called for help. My job now is to stay calm and breathe. This mindset helps stop panic, which can worsen the attack. Think of your heart like a fragile engine running on low fuel. The more you push it, the faster it burns out. But if you stay still and calm, you conserve energy and give rescuers time to reach you before further damage occurs. Stillness, patience, and control are your best tools for survival in those crucial final moments before help arrives. A heart attack can strike anyone, anytime, but knowing exactly what to do can save your life. From calling emergency services immediately, taking aspirin, loosening tight clothing, staying calm, to unlocking your door and controlling your breaths. Every action counts. These 7 simple steps can buy you precious minutes, and minutes can mean the difference between life and death. Stay prepared, stay alert, and keep this life-saving knowledge at your fingertips. Share it, practice it, and make sure your loved ones know it too, because survival starts with action.